Hi, I'm Ali Baj. I was honored to co-moderate along with Dr. Hu one of the first sessions of the pre-meeting. It was on the topic of AI, machine learning, and really other innovative ways to make clinic easier, documentation, intraoperative planning. We had outstanding speakers throughout the sessions. I think this was a very, very important session for the SRS. There was significant engagement, a lot of great participation, important topics that are affecting us really on a daily basis, and certainly more to come. So we had outstanding speakers, a very important topic on AI and innovative tools, both in the OR, outside of the OR. Just an absolutely terrific session with excellent engagement. I was honored to co-moderate it, and we're looking forward to discussing these topics again, really throughout the conference.
Hi, my name is Peter Pashis, and I participated as a moderator and helped plan the HIP session yesterday at the 60th annual SRS meeting. And we had a record attendance, and we had a tremendous amount of high-level talks and really great participation from the audience. I think one of the highlights for me was the session on sagittal deformity and sagittal alignment, and really leaders in the field discussing really conflicting views on a really complicated topic and something that's really tied to our outcomes. So I was very grateful for my co-moderators, Christine Hardesty and Lindsay Andras, and I think hopefully we gave everyone a really nice experience, and hopefully everyone enjoyed it as much as I did. Thank you again.
My name is Alan Cadado, and I just moderated the lumbosacral obliquity session with Dr. Eric Kleinberg. We started off with talking about congenital lumbosacral anomalies, and then we transitioned to talking about lumbosacral deformity in idiopathic scoliosis, and last but not least talked about lumbosacral deformity in adult scoliosis. We had a wonderful session with excellent faculty and great cases, and we took a lot of great questions, and I was very excited to do that session.
There was a lot. There were so many great sessions.
So many good sessions and presentations today. Something that came up in my mind is, this concept of, should we go to L3 and leave some tilt below, or do we need to go to L4? And we had Dr. Kwan on the one side, who I spoke to him afterwards, and he feels very strongly that if you go to 3 and you leave tilt, over a longer term follow-up, you're going to see degeneration in that disc below the LIV. So his current recommendation is to go to L4. Whereas in contrast, Dr. Hariharan, for example, is emphasizing, which many of us do, stopping short, if possible, ending at 3 and allowing for some, disc wedging below that. So this is a question that I think we as a society really need to answer moving forward.
I agree, 100% important, and I think that a lot of surgeons we have to take home very similar. So
that's great.
Perfect. Well, thank you, Dr. Heffernan.
Thank you.
Appreciate it. Absolutely.
My name is Carl Eric Albin. I'm the chair of the SRS 3D classification task force, and today we had a lunchtime symposium that was named "It's Time to Transition from 2D to 3D." And so during this lunchtime, we introduced the rationale to go from 2D to 3D. Then we presented a step-by-step presentation of the new 3D modifiers in the transverse plane, namely a regional and a local modifier for each curves. And during this presentation, we then presented a few cases, enabling to illustrate the differences between case that look similar when looking on the X-rays, but at the features that the 3D descriptors enable to distinguish. And we conclude this with a perspective presentation by Dr. Newton, and and also during this lunchtime symposium, we circulated 3D printed models, enabling to have a better understanding of the new indices we have developed. So it was well attended, and we received nice feedback from this lunchtime symposium.
Hi, this is Mitsuyagi from Tokyo, Japan, and we have just finished adult spinal deformity session.
I am Emmanuel Ferro from Paris in France, professor of orthopedic surgery in Georges Pompidou Hospital, and we were together for this ASD session.
So, Emmanuel, what's most favorite abstract among the sessions?
So I found we have many different abstracts, so it was really interesting. It was a very rich session, and I really like the one about gait analysis and new dynamic parameter in ASD to go further in the analysis. And so I really like the discovery about gene. I think it's a really good improvement for for ASD treatment.
That's really interesting.
What about you?
So my finding is the muscle biopsy study, which is I think it will be actually the ground breakthrough study, which indicate the difference of the MRI expression for patients who had a PJF and those who did not. So unfortunately, they failed to show the difference for pathohistology, but fortunately, they're going to improve their study and there will be a ground breakthrough study. Thank you.
My name is Stuart McKenzie from Nemours Children's Hospital, Delaware.
And I'm Brice Larbeau from Paris, pediatric surgeon.
We had the honor of co-moderating today the neuromuscular and syndromic spinal deformity session. We had a great, very interactive session today.
Yeah, it was a very strong session, very interactive, a lot of questions online, and a lot of papers focused on improving patient outcomes by looking at the preoperative comorbidities, which was extremely interesting.
Absolutely. We talked about sagittal balance and neuromuscular scoliosis, risk calculation. It was highly engaging, valuable session.
Hi, I'm Jeffrey Gunn from Louisville, Kentucky at Leatherman Spine Center, and my co-moderator was...
I'm Javier Pizones from Madrid, Spain, and we both co-moderated an adult deformity session.
Yes, it was the second session on adult deformity. It was a phenomenal session. The thing that stood out to me, there was a lot of sagittal plane talk. We know that there's lots of parameters going into that. We're getting a little bit more elegant with our parameters and equations to help minimize PJK and mechanical complications. And hopefully we're doing it in a more digestible fashion.
The other thing that struck us in this session is about self-image. We thought that self-image was important only for adolescents, but now we know that in all ages this is important and is linked to satisfaction.
Hi, my name is Per Trobisch. I was the moderator for the AIS session, and we were specifically talking about VBT and AI, and it was an awesome session. We're talking about the 5 and up to 8 year results. And now it's really getting into the details, when and how and technically and what is the best timing. And I have the feeling interest is getting much higher, and I think the outcome is also getting much better.
Hey everyone, I'm Koi Than. I'm one of the members of the SRS Social Media Committee, and I'm here with Bob Cho. Bob, can you just introduce yourself to the audience?
Yeah, I'm Bob Cho. I'm in private practice in Los Angeles, take care of children mostly.
Bob just did a great job moderating a session on early onset scoliosis and all the best research that was submitted on that topic. Bob, what was the highlight for you?
Yeah, it was a great session looking at early onset scoliosis. And I would say the biggest highlight was a paper by a medical student, Ryan Abid. He basically showed that with our patients who get cured for idiopathic scoliosis in a cast, they often don't stay cured. So those kids need to be followed because a third of them can proceed to failure. I think another highlight of the session is that pulmonary function tests are usually effort dependent, and some of these kids can't perform that effort. Clayton White showed us there may be a better way to do that with a new technology that's coming out.
Awesome, really impactful research, and you did a great job moderating.
Oh, thank you so much.
All right.
Hi, I'm Amit Jain, and I'm here with Dr. Ferran Pellicer. We just finished a fantastic session on spondylolisthesis, kyphosis, and bone quality. We had a variety of papers that were really fascinating from all parts of the world. It was a wonderful session with full of engagement. A couple of papers that caught my attention. One paper was on high-grade spondylolisthesis, and patients were still being treated with in situ fusion. Created a lot of discussion and challenges among the audience. Great paper. What did you think, Dr. Pellicer?
The session was fantastic, and the opening was even better, with an excellent paper from China describing a new technique to treat severe angular kyphosis.
Hi, my name is Brian Newman. I just moderated the Adult Spinal Deformity 4 session. It was a great session. We had a great discussion about methods to prevent PJK and how it occurs. And it gave more questions came from this. And in the future, we'll continue to evaluate this to see how we can reduce the risk of this problem. Thank you.
Hi, I'm Laurel Blakemore. I am the outgoing president of the Scoliosis Research Society. Just moved to past president today. I was fortunate to be asked to moderate the final session, which was about safety value. It was really, I thought the papers were really great. There was a good audience participation, and the topics were really kind of questioning what we do a little bit, and they challenged me, I think, to think about some of my practices. Some of the things we do are changing so quickly that it's almost hard to study. For example, that we talked about multimodal pain control protocols, and so the addition of steroids sounds very promising. Sometimes that's been hard to study because a little bit that gets done anyway. So there were a couple of things like that that really made me think about how I can take better care of my patients at home. So I found it very valuable. The questions in the audience were great, and the presenters did a really nice job to finish up the meeting.